Welcome back to Bombastic Nation and Ting and Ting and Ting. I'm Mr. Giant and I'm back with some more vibe for all you. And lately, healthcare seems to be a big question here, especially in the States. And I have some co-workers who were complaining that they noticed when they went back to the doctor, things that like medicine that was like $5 is all of a sudden $20. It seems like healthcare is going up and up and up here. And this was just last week. And they were mad. I mean, at least 5 of them complained that things they used to get for like a really low price all of a sudden is jacked up $15, $20. So let's see. And they're always comparing the healthcare system here in America to the healthcare system in Europe and how it works and stuff. So this one is called Italy versus the USA healthcare in depth. Let's go ahead and YouTube and simmer and see what the differences between the two healthcare systems and the cost and stuff like that.
And welcome back to my channel. Today I'm doing a highly requested video. I'm going to be talking about American healthcare versus Italian healthcare. Now you guys know that I try to be really impartial, that despite the fact that I love Italy, there are some flaws about living there, and despite the fact that I left America and have no intentions of returning to live here, there are still some good things that America does. In this video, I have to be pretty straight up and forward with you guys that when it comes to healthcare, if we're comparing Italy and America, for sure America is the big loser. I want to start with the actual numbers. And the last World Health Organization ranking that they did in 2000, they took all of these countries and they looked at all these different components to see how the systems work. In that ranking, Italy ranked second in the world. Equity, how much it costs, all the components together, Italy was second in the world. America ranked at 47, and that means there are 36 countries in the world that do better than America, providing their people with affordable, adequate healthcare. Because I know that people would say, oh yes, but Italians pay so much taxes to afford this super expensive healthcare system. Italy spent about 9.2% of its GDP to cover its healthcare costs, which is actually roughly 1% below the average of what industrialized countries spend on their healthcare. Per capita, Italians spent around $3,000 a year to cover their health insurance, whereas in America, it was $8,000. Now, what does per capita means? That means per person in Italy, per person in America. So if you take the whole huge bill of health insurance and divide it by the 60 million Italians that are there, you get 3,000. Now, if you take the whole big bill of American health insurance and divide it by 300 million people, you get 8,000. Every person in America was paying around $8,000 for this system that works like shit, whereas Italians were paying $3,000 for a system that covers everyone. The World Health Organization rankings came out in 2000, and the GDP per capita information is from 2012. Even if Italy went down a couple spaces since the 2008 crisis, and even if America moved up a couple spaces thanks to like the expansions due to Obamacare, they're still worlds apart. In Italy, 77% of healthcare is funded publicly by the government through higher taxes. In Italy, you do have the option to get private health insurance, go to a private doctor, private hospital, but given that the public ones are so good and essentially you're not paying anything out of pocket for them, no one really does that. If you get sick in Italy, you go to the doctor and you don't have to pay anything for it. The most I've heard of somebody paying is 20 euros for the ambulance ticket. You know that how much an ambulance ride costs in America? Something around $3,000.
Yes.
You have a baby in Italy.
How crazy is that, man? They come to pick you up and you gotta spend a whole lot of money. You might as well drive yourself there. But if you drive yourself there and you're driving fast, cops pull you and give you a ticket, you got to pay a whole lot of money anyway. It's like they get you there or they get you there. You know what I'm saying? In that situation. But good Lord Almighty, man. So if I have a broken leg, I'll probably walk to the damn hospital before call an ambulance or something, because they're going to take you to the cleaners. And you got these private companies, and man, listen, these private, I don't trust them. I don't, because they thinking of the bottom line. They're not thinking about your well-being or anything like that. They're thinking of a straight up bottom line, and that's the problem. You know what I mean? Medicine shouldn't be a for-profit. business. It shouldn't. It should be something to help people. You know what I'm saying? And we should be able to pay and get proper health care. But you know, when you have a government that's allocating money here and there and everywhere, you can't even trust them to keep the money so that it could help you. You just can't. It's crazy how it is.
You don't have to pay for it. It's covered in your health insurance. Whereas in America, the average cost of a birth is $30,000 for a regular birth, $50,000 for a C-section. Italians, yes.
$50,000.
Last year when I was working in Italy at that school, I was working as an independent contractor.
$50,000 so that you could produce worker bees for them. You know, like I tell people, man, you know, your child's born, if you don't tell that child to get educated and stuff like that, they're just going to become worker bees. So you're paying $50,000 or $30,000 to create worker bees for the same people that's charging you an arm and a leg to bring them into the world. It's crazy how that stuff works. They got the system on lock.
The second that I earned more than 5,000 euros in that fiscal year, I would have had to start paying 22% of my income in taxes, plus different fees that come along with paying taxes in Italy. I know, weird. And it would have amounted in roughly 40 to 50% of my everything I earn. Now, that's as an independent contractor. Obviously, if you get some contract with a job, like a subordinate contract, you're going to be paying less than that, quite high compared to American taxes. But I bet you if you ask any Italian on the street if they would trade their high taxes and social system that they have for the low taxes we pay in America and the social system we have, they would say hell no. Now, these are just the numbers, these are just the statistics.
And here's the thing about that, you can't explain to people, you know, I've asked people before, would you pay higher taxes to get better health care, or lower taxes and pay out your arm and a leg to private companies and stuff that's gouging you, the crap out of you? And they would rather pay the private companies because they think the government is taking advantage of them as it is. To give them more money means they're going to get taken advantage of them more. People just don't trust the government. And this is not me, man. These are Americans I talk to on a daily basis because, you know, I have a simple job just like everybody else. And I go to work every day and I come home and I talk to them, you know. I guess as a sociologist in me that keep asking questions of these people, but the point is, it's crazy how that is, you know what I mean? So they absolutely doesn't want the government to get any more of the money because I don't think they trust that the government would actually put the money towards what it's supposed to go. That's why for so much, a lot of people are against it. But politricksters, what they do is, they push it out as communism if they do that. Like the government is taking all your money. And you see, they're telling you, don't give me your money. And people are going, well, I don't want to give you my money because I think you're going to misuse my money. So it's really convoluted. I mean, it's really crazy.
I want to put like a personal spin on it for you guys and tell you guys about my experience with the Italian healthcare system, what I get back from the Italian healthcare system as an immigrant, as a guest in their country, and what I get back as an American citizen in America. In Italy, I pay 100 euros a year to get like this health insurance that comes with my permesso. A permesso is like a green card or a visa. It's something that says I can legally stay in Italy as an immigrant. Every year, I pay 100 euros to get a full year's coverage. So if I break my leg or get hit by a car or something in Italy, I am covered from that health insurance. As an Italian citizen, you get this thing called a tessera di sanitaria or whatever. And if you take that to the doctor, that you're covered. You can, of course, like I said, buy other private forms of insurance. Maybe the one I have is a form of a private insurance.
So that is what, there was an Italian person that watched my videos that explained that to me there, where she was talking about if you're an immigrant, you just pay $100. So that's what they were talking about. You know, I don't remember the name of the person that commented on the last video I did about healthcare. But that's what they were talking about, and I was kind of confused when they said it, and she just explained it nicely there. Cool.
But €100 a year is nothing, okay? Because in America we'd be paying minimum of $100 a month. So I pay 100 euros if I need to.
A month? She ain't lying.
I don't need to pay for it. That's really the big takeaway from it. But there are some things.
And here's the thing. You pay out the wazoo, you know, for insurance. And then the insurance company try to find ways not to cover it. They don't go, oh, look, he's sick, you know, let's cover it. No, they want to keep that money. I'll give you an example. I work for a toy store. Never used the insurance. Years and years I'm there because, well, I'm still a relatively healthy person. But didn't use it. My wife at the time needed to have a tooth pulled. So she went, it was a weekend, and the dentist for some reason wasn't open. So she went to the hospital, had the tooth pulled there. The insurance refused to pay it because they said because she went to the hospital that made it non-dental. So they refused to pay for it. So after 15 years of paying for insurance, boom, they find a way not to pay for it. And this is what they do, you know what I mean? Now, some insurance companies are a lot better than others. I ain't gonna lie. I ain't gonna say they all are like that. But, they're gonna find a way not to pay it. And then there's a trend now so that companies want to find a way not to have insurance. So they pump you down to half-time, so you have part-time, so you don't have insurance. And they keep you under there, even though sometimes you work full-time or full-time hours. It's really crazy. So it's like everything is working against you. You know what I mean? And this is what I try to explain to people. Why do you have a government if the government is not making sure that you have such things? They're telling you that the government is in your business, it's in your business, blah, 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 blah. But they have to be if they want to take care of the people. In essence, what they're doing here is they're taking care of rich people, and the poor people are just struggling. It's crazy.
Things like, for example, in Italy, dental insurance I don't think is covered by that. So I can't just go to the dentist and get my teeth checked up like I would in America. And I don't really know how it works with psychological things. Like, I don't know if I could just go to a therapist and that would be free too. I doubt it. But it seems to me that the Italian healthcare system just gives you what you need. And I guess they're doing a pretty good job at whatever they're doing because the Italian life expectancy is one of the highest in the world, and the overall cost of the Italian healthcare system is really relatively low. If somebody was in my same position as a student in America, they wouldn't be paying 100 euros a year for health insurance. They would be paying a couple $1,000s to the school per semester to get health insurance. If you're lucky enough to get a job in America,
and then they find a way not to pay it.
Then we segue into how the American healthcare system works. So we kind of covered the way it is in Italy. They have a mostly publicly funded healthcare system. All Italian citizens are eligible for the basic one where you can go to the hospital for anything and get treated, but you do have the option to get a private health insurance, so you can go to private.
That's a good idea.
Higher quality health insurance that isn't necessarily necessary, but you still have the option, So now let's switch gears to how shit works in America. In America, like everything else, our healthcare system is mostly privately funded. Most of the people insured in America are insured through their employers or through private health insurance companies. The rest is publicly funded through a couple of different programs. You have Medicaid for poor people, Medicare for old people, and the TRICARE system for if you're in the military. Or they just are uninsured and can't go to the doctor. Growing up, I got to experience a few different systems. When my mom first came here, she was an immigrant from Jamaica. I've told you guys all of this. She didn't start out from the bat with a really awesome job. She was pretty poor. She started from the bottom. And so when we were first around for the first few years of my life, we were on the state insurance, the Medicaid for poor people because we were poor. Then she got married to my stepdad, who works as a journalist and was also in the army. So then we got the health insurance from his job. I can't remember which health insurance that was, but it was pretty good. Then when the 2008 financial crisis hit, my stepdad got laid off and never found a job again. We got put on Medicaid again. And that was really good for me growing up because Medicaid, it seems, is the best health insurance you can have. When you are on the poor person health insurance, it covers everything. You can go to the doctor. You don't have to pay any co-pays or anything. You just go to the doctor when you're sick. You go to the doctor when you need a checkup. It covers dental. It covers psychiatric. It covers everything. When I went to get this $700 birth control in my arm, I didn't pay anything for it, and it was awesome. Fast forward to last year. In a nutshell, my stepdad got cancer, so he wasn't able to go to work anymore, and since he wasn't able to work ever again, he got disability, and he also turned old enough to get the pension from the army and his old job. So due to the fact that he was getting disability and 2 pensions, which, I don't want to put my whole family's financial information out there, it wasn't a lot, but it wasn't enough for us to be considered super poor anymore. We weren't poor enough to get the state insurance anymore, so they kicked everybody in my family off. Since I'm over 18 and not going to school in America anymore, they wouldn't even let me stay on my parents' health insurance. They wanted me to get my own health insurance and go into that pool of either buying private health insurance or being uninsured. At the end of the story, my stepdad ends up living. The cancer went into remission, everything's awesome, but he still can't work. So we were in this predicament where we needed to obviously get health insurance. Luckily, since my stepdad was in the army, he was able to go to that third option, which is the army health insurance. I thought it would be better. I showed the American government what I made last year in Italy, which wasn't really anything, and what I made from YouTube, which wasn't really anything. So I qualified now as a single person for the poor person health insurance, and I also get the army health insurance for my stepdad. So I get to pick and choose which one I want to use. I'm lucky for that. The rest of my family's on the army one, and they don't like get anything. For example, my sister started going to this therapist that I was going to when I was a kid. When I was a kid, I didn't have to pay for anything. My sister now, my mom has to pay a $20 copay, I believe, every time she goes, and the army only covers 8 visits. 8 visits of psychiatric treatment. Of all of the agencies in America that should be spending on mental health and should be covering mental health, the real problem is that to be considered poor enough, you have to essentially be making nothing. Now I want to go online and see how much my health insurance would cost if I was making an adequate amount of money to support myself. We'll say around $10,000 a year, because that's about how much you need to get taxed really in America. If you make under $10,000, you're not going to pay really any income tax, but if you make over, you're going to pay income tax, and that is considered the poverty line. A person making minimum wage in America is considered above the poverty line. Now, we all know that minimum wage in America is not something that you can really survive off of, but that's considered more than the poverty line. If you have children, like my mom did, of course your line is going to be higher. You can make a little bit more money, but given the fact you have children, you'll still be eligible for the poor health insurance. But since I'm a single individual, we'll say that this line is around $10,000. There's a website that you can go on to find national health insurance, okay? You put in your age, where you live, and that's pretty much it, and they show you the deals that you can have. First health insurance that comes up has an annual out-of-pocket maximum of $6,850, an estimated monthly premium of $85.40 a month. In America, we have these things called monthly premiums, which is essentially how much you pay every month to be able to have your health insurance. Then you have an annual deductible. What this means is up until this amount, you have to pay for everything. And then after this amount, the health insurance pays for everything. So for example, the deductible here is saying $6,850. That means until I go to the doctors and it costs more than $6,800, the health insurance doesn't cover anything. You have to pay for everything.
You see, that's how they get you. Because most people ain't gonna get so sick just to spend $6,000. They're gonna get sick to spend, like $1,000 here, $2,000 there, $3,000 there, but they're not gonna spend that $6,000 there. You know what I'm saying? So insurance would go your whole lifetime if you don't get deathly sick and need more than $6,000. The insurance wouldn't pay a damn thing, and you just keep paying into it. You just keep giving your money to these private companies. It seems like that's the way to make profit. You know what I mean? The higher the deductible, the more money they make. That's crazy, man.
Has this thing called primary care copay, because if you have health insurance, you should be able to get checkups from the doctors, checkups from the dentist and stuff like that for free. But if you have this health insurance or most private health insurance, you have to pay a copay. They're only going to cover some of it. This copay is $40. Emergency room, if you go to the emergency room, it says 0% here, so I'm assuming that means that they don't pay for any emergency room costs.
And emergency rooms are expensive now.
And that's pretty much the best one. All the other ones are more expensive than that. Ooh, there's one for $113.73 per month premium. And this is for a 20-year-old. The problem with healthcare in America is that unless you're really, 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 really poor, it sucks for you. And most people aren't they're not. Most people are very poor in America, but they're not poor enough to qualify for
qualify,
this
yeah.
health insurance. And that's a really big problem because there's so much stress on the middle class right now. As income inequality grows and grows, and the poor are getting poorer, it's like you can't even afford to go to the doctor. My older sister,
Can't afford to die.
a successful lady,
Cost your family an arm and a leg to bury you.
and she makes a decent amount for salary. For her, she has like a deductible of $6,000 a month or $6,000 a year or something like that. And I can't remember what her premium was, but it was really freaking high. And that's with her company her bank giving her health insurance. When she was at her other job, the deductible was like $4,000 or something, and they were right at the $3,099 mark or something like that, and then she switched her job and had to start it all over again. American healthcare system is a really complicated mess. I don't even know if I explained it well enough, but
you did a good job.
I choose the Italian healthcare system any day, every day. My thing is, if every other developed nation in the world can do it, America should be able to do it. I study economics as well, and there are plenty of countries in the world that are able to survive and have strong economies while not letting their people die in the street. 5 years ago, before Obamacare came into effect, people were going to hospitals, emergency rooms, and being turned away because they didn't have insurance. And like 15% of our population didn't have insurance before Obamacare, nothing at all. So like you couldn't go to the doctor. I think one thing with America is that we are deceived into feeling like we are the best country in the world. Everything that we do is amazing. We don't know how other people do things to know that how we're doing it is not the right way. We don't have this mindset to compare ourselves to other countries to see when we are sucking and to fix it. Because I don't know how Americans can know how this system works and see how it works somewhere else and accept that shit. We do need an overhaul. I mean, I know it would be really difficult because, of course, since we have a large private sector providing for health insurance, it's a large part of our economy. You can't just flick off a switch and it's gone. But
they're gonna fight
the
it.
way things are right now, Obamacare tried to make things better, but it still sucks. America versus Italy health insurance. Italy won the battle for this one. America, you have a lot of work to do. Be sure to like and subscribe if you haven't already.
Yep, you're right. I mean, and people are sick a lot. I mean, where I work, there's at least 3 people who goes for chemotherapy because they have cancer. There's a ton of people with diabetes. People are so sick because of the diet is just shit. I'm sorry to say it that way, but it is, you know what I mean? To eat healthy, man, it costs an arm and a leg here, you know what I mean? I try to eat healthy, but there are times that I don't have enough money that I have to go, you know, and buy something that's not healthy for me, and I could feel the difference when I eat and thing, you know what I mean? Well, I could feel the difference. That stuff is killing people, you know what I'm saying? But yeah, and it's even getting higher. And the last thing I saw is that there's a guy that owns a basketball team. Mark Cuban is his name, and he's boasting that he's opening up a pharmacy online that's going to be like cheaper than the normal. Am I supposed to trust this dude? Come on now, he's not just opening it up to help nobody. Sooner or later, them prices gonna skyrocket. He gonna want to make a profit, and if he's not making any money, he's gonna dump it, because he's a businessman. And therein lies the issue. You know, they're voting in businessmen, thinking businessmen will make the country into a business, and everybody's gonna benefit from that. But then think about it. Where you're working, they're cutting your hours so that managers could get bonuses, so that the top could get more money and that could get more money. If they're running your insurance, they're going to do stuff so they could make the money. Come on, people, wake up. God, it's time for me to start traveling and checking out other things, you know what I mean? I mean, I've always been like that, you know. That's one reason why I traveled here, you know, just something different. But anyway, I ain't going to keep you all too long. You all take care of each other, all right? Really do take care of each other. Cool runnings.